Hello, my name is Dr. Sarah Abdelmaqsoud. I'm head of the radiology services in General Department of Radiology, Ministry of Health and Population Specialist Radiology Services. And with me is Professor Francisco Giganty. I'm pronouncing the
Yes.
name right? Professor of Radiology in UCL from London. Hello, Professor.
Hello.
Welcome to
Hi.
Egypt.
Thank you.
This is your first time joining us here in
Yes,
Okay.
correct.
And how do you find it so far?
It's amazing, actually. I'm really impressed by all the people who are attending, and I think it's going to be a great opportunity also for me to foster more collaborations. So thank you so much for the
Great.
invitation.
Thank you for being here. So your area of concern or interest is the prostate.
Yes,
The prostatic MRI per se, or the prostate in general?
Well, it's prostate in general, but especially prostate MRI as a radiologist. So I did my PhD on prostate MRI, and I'm still working on this from a clinical and research point of view.
Okay, great. So what is your talk or your workshop? What are you doing in this scientific meeting this year?
Yeah, so I have just had two talks, one on prostate MRI and image quality, which is something really important. And the other one is prostate MRI, the use of prostate MRI during active surveillance, which means that you have your patients that are followed up after the diagnosis of prostate cancer, and they are diagnosed with prostate cancer and monitored with MRI. And now I'm going to have another workshop with Professor Malal, and we're going to teach the attendees how to interpret prostate MRI.
Well, MRI and prostate and all of the pathologies, along with the equipment, are advancing on a daily basis, almost. Like each day there is something new. What is the newest thing that you have found very interesting when dealing with diagnosing the prostatic cancer with MRI or even with other modalities? If you, because I'm sure that you might use other modalities as well, plus the MRI.
I think one of the hot topics that I think can be applied to all radiology, but especially prostate MRI, is artificial intelligence, so AI.
Okay. This is the talk of this
It's the
conference
talk
and every
yes,
conference.
exactly. And the reason is that because there are many AI tools at the moment on prostate MRI that, of course, needs to be fine-tuned because we are not still there. But I think AI will be able to help us a lot in prostate MRI segmentation, for example, but also in terms of the detection of disease. I think this is the most innovative topic.
Are you starting working with AI at UCL?
So I haven't started yet. I'm collaborating with some AI companies, but only for research purposes. So we are not using AI as a clinical tool yet.
But is there like an AI that is used in other countries or other places that is now developed and is really helping with the diagnosing?
So there are some tools that are currently used, but the thing is that the final word is always the radiologist, basically. Yes. So that's the most important thing. So yes, there are many AI tools that some are already CE approved or FDA approved, so they can be used along with a radiology report, but the final say is always the radiologist.
So if a patient comes with a certain complaint within the prostate or related to the prostate, do you proceed the first step with MRI, or there are other things that you have to do first?
So
other imaging solutions like transrectal ultrasound or?
So yeah, the most important thing is that basically the patient sees the GP and the urologist, and they usually have a PSA, and then they have an MRI. So there is no role for ultrasound. So basically also the European and American guidelines support the use of pre-biopsy MRI. It's really important to have the MRI before the biopsy, so that if there are any lesions, we can target them and have a more accurate diagnosis. So the first imaging technique that should be done for the diagnosis is MRI.
Okay, and with all the things that you are participated today here, what is the most advanced info that you are passing to people here, or you would like people to know?
So I think the most important thing is to establish a collaboration between the radiologist and the other doctors, the other clinicians, the urologist and the oncologist, the pathologist, because we play a very important role in the diagnosis and management of these patients. So that's the most important thing. And the other thing I'm trying to stress is to, if you want to start doing prostate MRI, or if you already do it, you have to check that the quality of your images is good, and also that you are a good reader. And for that, you need some training, some sort of training, and you need to read a certain number of scans.
Okay.
So, yeah.
And do you work in of course, you work with the screening of the prostate with MRI?
So yeah, we haven't started yet in the UK. We have big program that will start next for the next few years, and it's going to be a very widespread screening program. I heard that there is a screening program that is taking part here in Egypt, so it's a really good thing, and we are really excited to see the results.
So you're mainly working with the diagnostic part?
Yeah, diagnostic or also after therapy.
Okay, and do you have like any statistics that you would like to share in the cases that you have worked?
In terms of
percentage of cancers, most likely cancers that you have found, most findings that you find within the MRIs themselves?
It really depends on the prevalence of the disease in the country. So basically, I think one of the most important things is also, according to my experience, is that the radiologist reported the scan is a very well-trained radiologist to reduce the number of indeterminate lesions. So we should aim to have a very low number of PIRAS 3 lesions. And I think this is something that we should look at both in our center, in each center, but also at a larger with a larger audience, basically.
Okay. In your opinion, this is something that I always find. Not a lot of radiologists work with the prosthetic MRI. They don't have, we don't have a huge number that has experience, just like the general diagnosing modalities or body parts. Why is it always the prostate is a bit less in terms of expertise?
So I think, the first and most important thing also from, a national point of view is to have more MRI scans. But having more MRI scans doesn't mean that we are solving the problem, because we also need good radiologists who are able to report the prostate MRI accurately. And for this, we have dedicated courses that can be done both nationally or also internationally with the European and American Societies of Radiology. And this is something that is really important. And I think it's a balance between having the right number of MR scans, of course, so that we can give people a possibility.
See the cases, yes.
Exactly, but also have the right staff.
For the staff to be a bit expert or to start on the right track, how many courses does he need? How long does it take to have an eye for this kind of technique?
So there is a paper that was published a few years ago saying that in order to become an expert, you should read at least 500 prostate MR scans. So that's the initial number. And for that, actually, I think I would strongly suggest that those interested attend courses that teach you how to read prostate MRI. And then also, one of the other most important thing is to always look at the pathology of the lesions that you have called in your report.
So that you coordinate what you found with.
Because you can learn a lot from as everyone. We can all learn from our mistakes, if we make mistakes, of course.
At the end of this very nice and informative talk, what is your take-home message to any radiologist who would like to start in this field of prosthetic MRI?
So I would say the first and most important thing is to evaluate the quality of your prostate MR scans. As we have seen today with in my talk, there is a dedicated scoring system called PIQUAL version 2, and this can be easily applied to all of the scans. So this is the first and the most important thing. We have to do it right from the beginning. So if we have the right images, then we will be able to proceed in the MR diagnostic pathway. And the second thing is to attend courses to learn how to read prostate MRI. Of course, you must have a good quality MRI first.
Great. Thank you so much for your time, Professor Francesco. Thank you so much for joining us for this podcast, and see you soon.